The broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone, and welcome to today's webinar entitled Battling Burnout, Redefining Success and Taking Care of Yourself. I'm Laurie Carter, and I'm the Social Work Coordinator for the Open Doors program, and I'm here today with Laura Bingell, the Open Doors nurse. Hi, Laura.
Hi, everybody. It's good to be here with you.
I don't know about you, Laura, but there's definitely been times in my career when I felt a little beaten up and burned out.
Well, yeah, there have been times for sure.
And unfortunately, in our line of work, I think it's fairly common to feel this way at some point. And so that's why we're offering this webinar today, is to discuss burnout and, as I said, redefining success and taking care of yourself. Whether you're a transition specialist, a housing specialist, or a peer, most of us are in our jobs because we care. We want to help. We want to be a part of the change that we know is so desperately needed. In short, we want to make a difference. And these are the traits that drew us to our jobs in the first place, but they're also the traits that can make us more susceptible to becoming overwhelmed and feeling burned out, especially when we're doing the type of work that we all do. Over the last couple of years, as we've traveled around the state, we've heard very similar frustrations and feelings from transition specialists from Buffalo to Long Island and everywhere in between. So today, we want to take some time to acknowledge those feelings, to discuss what success is in the realm of our program, to discuss burnout, what it might feel like to you, how to prevent it, and to offer some suggestions on how to stay emotionally healthy so we can keep all of you in this field for years to come. We really want today's focus to be on you, so feel free to ask questions and make comments. You can raise your hand or you can type a question in the question box. So we want this to be an interactive webinar, so feel free to ask questions as we go along. We'll start by acknowledging some of the frustrations and issues that we've heard from you. One of the things I hear frequently is the fact that this job, being a transition specialist, and I would guess probably a housing specialist and a peer as well, is a lot harder than many of you thought that it would be. Well, the idea or the concept of helping someone move from a nursing home back into the community seems fairly simple. Well, Mr. Jones wants to leave the nursing home, so we'll find him an apartment, set up the services he needs, and help him move home. In reality, however, transitioning someone can be very challenging with all kinds of obstacles and barriers. And although some transitions go smoothly, often for us in this program, our transitions aren't the easy ones. Our referrals tend to be the more complex and difficult cases. Next slide. Some of the other frustrations we've heard include the lack of services in the community, having to constantly advocate for what should be a given, watching people fall through the cracks, high caseloads, professionals that basically don't know how to do their job, and on and on. Of all the frustrations we've heard, the number one frustrations has to be participants not being able to transition. I think as a transition specialist, one of the most difficult things is when our participants can't or don't transfer, when they can't go back home. We put our heart and soul into our work, and when someone can't or doesn't transition, it can be really hard for us to deal with. Next slide.
So there's different things that might frustrate you, particularly when you're dealing with some of the things that are listed on the slide here. No appropriate available housing, repeated referrals on the same person, unreliable supports, whether it's formal or informal, and the ongoing health problems that the people have that they need to deal with while in a facility and then while they are out of a facility. and also your own personal feelings about the success. And sometimes this can also be poor choices after you've worked very hard to help the individual formulate a plan and move to the community. Some of their choices may lead them to eviction, or say choices to not take the medications that are prescribed ends them back up in the hospital. And this can be very, very frustrating. So do we expect personally that all the people we work with will successfully transition? What if it doesn't work out? Does this reflect upon me or you as poor job performance? So you work very hard for all the people you're assisting, and it seems that a lot of the time the effort that we use to get them home only was successful for a short period of time. So how do you feel when that happens? Do you feel like you let them down, or that they let you down? These are some of the things that we will be touching on.
I think Geraldine has a question. Geraldine, I'm unmuting your mic. Geraldine, can you talk? All right, so Geraldine, if you could just type in your question, because we're not hearing you. I'm going to put you back on mute, but just type in your question and then I'll, oh, there she says. Yeah, you said, I guess you can't hear me. So no, we can't hear you. So can you type your question? Oh, she has a comment. So what is your comment? All right, so when she finishes typing in her comment, I'll read that back, okay? But Laurie, do you want me to go to the next slide?
Yes. Another widely expressed frustration is the fact that as a transition specialist, you guys are continually needing to advocate for what should be a given. For example, having to fight for people to have the right to risk, having to fight to allow people to make their own choices, to get the services they need, and to be treated with respect. While being an advocate can be really exhilarating, it feels really good to stand up with someone and to know that you were instrumental in helping them get whatever it is they want and need and have the right to. But as many of you have expressed, it can also be very hard work, and advocacy can be exhausting.
So Geraldine's comment is, sometimes an individual has a higher level of care that would require a daily nurse that is not covered by an MCO. So I think she's saying that's one of the frustrations as well, is when we can't actually find enough services in the community to meet the person's need.
And I think you're absolutely right, Geraldine. That's a huge frustration. You do put your heart and soul into your work, and when you make the referrals that are needed to either the waiver or to MLTC, and you find that the services are not there, then that is very frustrating for both you and the person. Next slide.
So this is one of the things that we've mentioned here, and we've kind of included that in ending relationships, because that can be one of the things you feel that you've tried very hard and there aren't the services that this person needs, or they cannot become available for some reason to this person. So we know when we open cases that we will be ending these relationships at some point. And sometimes it's very difficult to break news to people, whether it's that they've transitioned successfully and you've done your last QOL, or whether it's their family members not willing to assist them in their home, or their house has been repossessed, or something of that nature, and who breaks this bad news to them. So we have to maintain a balance of maintaining hope and being realistic, because after all, having hope is good and people need it when there's a basis for it. And There's also the times when people you have helped pass away. And this has happened more than once to many of you. And it can happen during any part of the transition process, before they leave or after they go home. And it's important to remember that living independently or being able to die in their own home can be the fulfillment of a very deep wish for some people, and the very last piece of the puzzle that lets them be satisfied with the outcome of their life. So again, maintaining that balance of how we view these types of things. Next slide.
So if you're not experiencing any of these thoughts or feelings that we discussed, then that's great. But if you are experiencing these or any that we've missed, know that you're not alone. You have many colleagues who share your concerns and are feeling the same types of frustrations. And the goal isn't to not feel this way. The goal is to learn to cope with and channel these feelings so that you stay emotionally healthy and avoid feelings of burnout.
So here we are. Here's the picture before work and after work. If this is what you feel like, then there may be some room for improvement to help you feel better. So these are some of the signs of burnout. We see it in other people, and we can see them in ourselves sometimes. Are you critical of yourself or others? Is it hard to get out of bed and go to work? Do you feel less satisfied with your job than when you started? And some of these too can reflect in our physical being, our sleep habits or our appetite changes, or we have unexplained physical symptoms, and that might be headache or high blood pressure or things like these. And so it merits some self-evaluation to see if you're the cat on the left or the cat on the right.
The impact of burnout is not only on your career. As Laura was saying, the impact on you personally is huge. We spend 8 hours a day at work, and when you're feeling badly about what you're doing for those 8 hours, in most cases, it will spill over into your personal life and into your relationships. We've all come home from a hard day at the office and spewed our anger and frustration and irritation onto our loved ones, and that's never a good scene. Being burned out can and does lead to problems with family, with friends, with our physical health. So we really want to do everything we can to prevent this from happening. So we've shared some of the frustrations that you've shared with us, and we've talked a little bit about what burnout is. Now we'd like to talk about some suggestions and tips on how to address these feelings, some strategies in preventing burnout, and some ways to keep ourselves emotionally healthy. To begin with, according to numerous studies, there are key indicators in preventing burnout. And some of the key indicators are finding worth in what you're doing. In other words, feeling like what you're doing is worthwhile. Another key indicator is being realistic about your work. So that being said, for us in this program, I think we have to remember that there is a difference between our ultimate goal and our ongoing job. Where our ultimate goal is to transition people living in nursing homes back into the community, and we do want to transition as many people as we possibly can. Our ongoing job is to assist each and every person referred by exploring the possibility of transition, looking at the options available for their individual situation, assessing the barriers, and doing the best that we can to resolve those barriers. Our job is to view each participant's situation with fresh eyes to be sure that all possibilities are considered and to offer the independent living philosophy in all that we do. because we face so many obstacles in our job, and because we're not always able to reach the outcome we hope for, people are not always able to return home again. And because our work is so emotionally laden, it's important to remember that even when our ultimate goal of transitioning back to the community is not reached, even when the person has to remain in the nursing home, if we've listened, thoroughly explored the options available, evaluated the situation and barriers with fresh eyes, then we have succeeded. And I stress this because I think it's vital to remember that one of the most powerful tools that you bring to the table is the independent living philosophy, to truly listen to the individual, to advocate for what they want, focus on what they can do, not just what they can't do, seeing the individual first before their disability. By utilizing this type of philosophy, you're bringing a sense of empowerment to everyone you work with, whether they're able to transition or not. Sometimes it's really important to remind ourselves of this and to reset our expectations. Remember, you won't be able to transition everyone, but you are able to help everyone. And I can guarantee you that you've helped more times in more ways than you'll ever know. Now, that being said, along the same line as we were talking about in terms of finding worth in what we're doing, it's also important to remember that we are meeting our goals. Remember, you're part of a larger program. Open Doors is part of a federal program called Money Follows the Person. And nationally, Money Follows the Person has transitioned over 75,000 people. 75,000 people, that's a lot of people who are now had the chance to live in the community who were before living in nursing homes. In New York State, since January 2015, when we started this program, we in New York State, you guys, have transitioned 2,385 people. And that's as of last Monday. So there may be even a few more. We may not be able to transition everyone, but over 2,000 people, that's fantastic. And it's important to remember and to remind yourself that you're part of that success. As they say, together we are moving that mountain and we are making a difference. You are making a difference, one person at a time. Another important aspect of maintaining emotional health and preventing burnout is the ability to set boundaries. For some people, this is pretty easy. For other people, like myself, setting boundaries can be a challenge. I think we naturally want to get in there and do what needs to be done. But it's very important for us to set boundaries. It's important to set boundaries with participants. It's important to remind yourself what you're there for. You're there to assess the individual's situation, to look into the possibility of transitioning, to look at the barriers and what they are, and to determine if those barriers can become overcome. You need to be clear about what you can and can't do. And make sure to share with participants what you're doing and what you found, and be honest. We also need to set and keep and maintain personal and professional boundaries. And this too can be a challenge for some. My advice is to keep work at work. Do the very best you can while you're at work, but don't work on your days off. Don't let work creep into your personal life. Don't answer the phone or the email on your day off. Use the out of the office automated message so that if we email you, we know you're off. But don't answer your phones or your emails on your time off. The other thing is to leave work on time. Remember the old saying, no one on their deathbed was ever thanked for staying late at the office.
I'm trying not to laugh, Laurie. I love that.
I know, that was Laura's quote, and I loved it. It's absolutely true.
Yeah. And
Very
just
true.
one thing I would add to that, and I think we discussed it when we were preparing for this, Laurie, was that the best time to approach this with the person telling them that there are boundaries is right on the very first visit.
Absolutely. Absolutely. That should be one of the things you're making clear is what you can do and what you're there for. Of course, it is a challenge because people hear sometimes transition or going home and they stop hearing anything else. So I think you're right, Laura. It's very important to set that up from the beginning and to reinforce it. So some other strategies for coping and some coping strategies for work and preventing burnout is to make sure to get the support that you need. And this is vital to your emotional health. I suggest that you find a work buddy. Everyone needs somebody that you can talk to, vent with, share with, and that is really important. And that person usually needs to be somebody who's in the field because they have to get it. It doesn't help to vent and talk to someone who doesn't understand what you're talking about, or at least it doesn't have the same benefit as talking to somebody who does understand. So that person usually needs to be someone in the field and hopefully somebody right at your job. Let's face it, there's a good chance that our families and friends, many of whom have never even been in a nursing home, they're not going to understand the stresses involved in getting somebody out of the nursing home. So my suggestion is to find yourself a work buddy and make sure it's somebody who really gets it. Another suggestion that somebody gave me years ago, and I did it reluctantly, and it really did help me. And that's to keep a success journal, to document your successes so that you can remind yourself of all you've done and all the lives you've touched, whether it's big or small. Sometimes it's the big things like transitioning someone, but other times it's the small things like hooking somebody up with paratransit so they can go out on a day pass, or hooking them up with a free audiobook or a cell phone. Sometimes it's just spending time with someone or sharing a laugh. Document those things in a little book, first names only, of course, due to confidentiality, but document those successes. And I guarantee you, when you're having a tough time in your day or in your career, and you're able to look over that, you will smile and you'll definitely benefit from physically seeing all the lives that you touched in so many different ways. We're very quick to remember what we didn't do, but we're not always quick to remember all the things we did do. So that's a little suggestion there. And as we sort of touched on already, it's really important to keep balance in your life. Your job is only part of your life. It's important to do a good job and to enjoy your work, but it's also important to enjoy your life. And especially if you have a stressful job, you need to make sure that you are not letting your job creep over into your personal life. When we're stressed out, we're more likely to say no to a lunch invitation or to skip an art class or an exercise class that we really want to do. We're more likely to not take breaks at work or to work through lunch or to stay late. And these are the times when we really need to take a break, when we really need to step away from work for a few minutes. Having that balance will keep us recharged and will help make the tough times easier. And finally, a really concrete tip is to make sure to keep your caseload organized. Find a way to organize your caseload. We work in a field that has a lot of moving parts. There's a lot to this job. There's a lot of little details, and it really will help you from being overwhelmed if you're able to keep organized. You can use lists. You can look at the reports that are in the database. If you're having trouble getting organized, don't hesitate to use the tech calls. We all have tech calls with all of you, and you can use those calls and we can help you to get organized. The database reports are fabulous, and if you need to know something and it's not on there, we can run a report that will help you to to organize your caseload. So, definitely look for ways to get and stay organized.
So this poster was a nice thing that I found on the University of Buffalo website, and it's a resource in what was called a self-starter kit for all of the social work majors at Buffalo University. And there's very many good resources for anybody in a human service field or in a helping profession. So I provided the link here for you in case you wanted to look at more of the things that they had. So some of the things that I just wanted to highlight from the poster here was taking up a hobby, doing something that you enjoy. Here it's talking about reading and laughing. So as Laurie had just mentioned too, maybe there's a class you've been wanting to take. Make some room for that and give yourself some tender care. And have friends outside of work as well as your buddy at work if you need to renew some old connections or make some new ones. And maybe that would be in this class that you've been wanting to do but haven't because you've been overwhelmed with other things. So honor what your own needs are and make room for yourself. You have to be able to care for yourself before you have enough resources really to care for others in a really meaningful way. So, and we care for you at NYAIL, so we want to be sure that you're caring for yourselves. We want you, as Laurie said, around for a long time.
I think too, Laura, it's really, that's a really important piece. I think we need to give ourselves the same consideration we're giving all of the people we work with. We really encourage them to take care of themselves, and we need to do the same thing. We need to make that time, even when it's difficult.
So then we might ask ourselves, are these some of the thoughts that I have? When we're thinking about being kind to ourselves in a physical way, we want to think emotionally as well. And if these are some of the thoughts you're having when something goes wrong, then maybe it's time to rethink how you view those things. I'll never get this right. I goofed it up again, or I always goof it up. Why do I even bother to try? It's just going to go wrong. And, some of these thoughts come from our histories, but you can look at this in other ways as well. Instead of personalizing things, learning how to learn from them and viewing failure as a way to learn. And that would lead us into the next slides, I believe.
Absolutely, Laura. I think in short, we really need to be our own best cheerleader. And the thoughts that we have about ourselves in our work are really important. And if you tend to have those negative thoughts, I think it's really important to give yourself, a positive reminder of all the positive things that you did. And the fact, like Laura said, that even if something does go wrong, it's important to look at the situation, to change whatever it is you need to change, and to move on. Overall, I really don't like the word failure in regards to our work. I think it's really important to remember that success is as individual as the people we work with. Sometimes it's going to be a big, huge success, and other times it's going to be really small. And like we said, even when things do go wrong, it's important to learn from the situation, to do things differently if you need to, and to move on. So, last but not least, I wouldn't be a good social worker if I didn't talk about the fact that sometimes we need professional assistance, and it's important to know when that time is. Sometimes we're dealing with a lot more than being burned out at work. Sometimes feeling burned out is really a symptom of something else that's going on. Life can be really hard, and if we're feeling depressed or anxious in other areas of life, it can easily seep over into our work as well. And it's important to get support for yourself in all areas of your life, whether it's going to the doctor if you have medical needs, or a mental health professional if you have emotional needs or mental health needs. Sometimes, like we've said, we're so busy taking care of everybody else, we don't take care of ourselves. But I do think it's important to point out that professional counseling, if you're hurting in other areas of your life, can be a great option in these types of situations. It can be an effective way to help people look at and cope with the issues in life that you're dealing with. No one needs to wait until they're in a full-blown crisis. You can seek counseling or mental health assistance at any point. It's usually covered through some extent through your insurance, and it can be really helpful. So I will open this up to questions or comments or anything that you have that you use to help you from burning out that you'd like to share with everyone.
So if everyone wants to speak, you can just raise your hand through the dashboard, and we'll unmute you so you can talk. I'll just say, Laurie, your comment about seeing a failure or a mistake as an opportunity to learn something, that's something that I feel like I do every single day. That, to the extent that you can learn something new, it isn't necessarily a bad thing. If you wouldn't have known it otherwise unless you made the mistake. And I think, I'm right in the middle of checking for the monthly report, and so I'm ending up sending a lot of emails to people who have done things, not in the correct way. And I always try, and maybe I don't do it well enough, but to explain why it's supposed to be coded a different way. And I think that's part of it, is that a mistake is just that, and that as long as you learn from it, it's nothing more than a learning opportunity.
Yeah, I think that's a good point, Suzanne. I think we all definitely can learn something each day. And in this particular job, like I said, there are a lot of moving parts. There's a lot of, did you check this? Did you, do that? Did you call this person? And there is a lot to it. And, as you learn, there'll be fewer and fewer of those emails, but absolutely, it's a learning experience. And it is for us too.
Absolutely. So I think you have some resources listed here. I don't have anybody raising hands or asking questions. Maybe you can tell us what some of these resources are.
Okay, the first one, like Laura said, it is the social work department starter kit at Buffalo University, and I think any of these resources are great. They're just some additional resources to look at burnout and taking care of yourself, which is really what burnout is. The opposite of burnout actually is taking care of yourself, and that's what we want to learn from this is to make sure, a reminder to take care of yourself, and any way that you can.
We have Kathy Sheehan has a question, so I've unmuted you, so you should be able to talk now.
Kathy?
Yes, hi, I'm here, but Patrick was the one that had the question.
Can we have a copy of
We do have it.
Okay. My next question today
Yes.
is if one of the participants needed resources or advocacy services, will it be wise to make sure you connect with your independent living center, and maybe an independent living specialist can go up with the peer or the transition person and do their part and make sure the advocacy part is done within the agency? Do you understand?
We always encourage the transition specialist to use the services that are available through their local independent living. That's why the transition specialists all are located at independent living centers. So whether it's a benefits advisor, some have independent living specialists, others have, I know some have special education advocates like you do at TRI. There's all sorts of different services that are available, equipment loan closets, et cetera, et cetera. So yes, absolutely, we encourage the transition specialists to use the services available at their local independent living center.
Okay, thank you.
Thank you.
That also brings up a good point, Patrick, that you were mentioning too, that when you utilize those other resources too, you're using the resources of the other people in the team to help this person, so that you're not the only one doing everything, which is something that can lead to burnout in many cases too. You have to realize that you are working as part of a team, and that you have everybody there at the ILC, you have resources at the NYAIL office, including Laurie as a social worker and myself as a nurse, and utilize the resources you have so that it makes your work a little less stressful. That's a wonderful idea.
Martha and Kelly have a question. Can you talk? Martha, I've got you unmuted. All right, looks like we can't hear Martha and Kelly. So if you could just type in your question, then we can read it off. I'm going to try Nicholas. He has his hand raised.
Hi, can you hear me?
Yep, we can hear you.
Yeah, so first off, just thank you for doing this. I'm surprised that I was surprised that I had forgotten this from being an ex-substance abuse counselor. I know a lot about it, but sitting here looking at the symptoms and the pictures and stuff, I couldn't help but see myself. So thank you for this. Then my other question is, in terms of finding individuals or colleagues when you're kind of a bit alone in your county, what kind of people would you recommend reaching out to, in terms of people who have boots on the ground other than OHS?
I think that can be a challenge for the transition specialists or the other professionals that are kind of lone rangers. So I think that can be a challenge, but I think someone in an independent living center, I think there are probably other people who have similar jobs and frustrations. And sometimes you have to do the best you can with finding someone. Sometimes if you have a professional association or go to, professional meetings of some kind, you can meet other people as well. But in an independent living center, you have a lot of people right kind of under your own roof. And I would bet some of them would be definitely appropriate, somebody who may not know exactly what you're doing, but will have a pretty good idea, because that can be a challenge.
Okay, thank you.
So Kelly Ray and Martha's question was, what have other transition specialists done to face the loss of participants that we have worked with right after they transitioned or even before they transitioned?
So I'm assuming what they're asking when they say lost is they're asking about people who have died?
I assume that's what they mean.
Okay.
Passed away, she says.
Laurie, I think you and I can answer this one together, and I'll say a few things, and then please pipe in, and don't feel afraid to interrupt me too. But first of all, like any grieving process, you shouldn't expect that it's going to be the same that if you lose a close family member, but you have to remember that you have a lot invested in a person, and you probably even come to be very fond of them. So you are going to go through the grieving process. And what you just need to do is you need to realize that these emotions are valid, and just be gentle with yourself and allow yourself to go through them. Allow yourself to be sad for the person or their family or even yourself, and acknowledge them. And this is another place where you can talk to other people about how you're feeling about it.
Absolutely, Laura. I agree 100%. I think it's important to remind yourself that the grief is real and your emotions are valid. And it's okay. It's okay to feel this grief. It's not a fun thing, but it is okay to feel this grief. It is real. I think it's also, though, important to remember in many of these cases, you have truly given someone a beautiful gift, and that is to have their wish of returning home before they die. For some people, it's the wish of dying in their own home, and you've helped them. And that is a tremendous gift that you've given to them.
And when they die before they go home, you've still given them a gift, because they have the gift of that hope. They had that goal of working toward it. So try not to feel that it didn't pan out for them, because they had something good that they were probably having good dreams about, something that they were really looking forward to, so that they didn't just pass away with no hope at all.
Yes, Kelly Ray says definitely agreed. Thank you. So, and there's one last comment. How can I feel okay when I slow down when there's still so much to do? I feel like even if I did slow down, I would just be haunted by everything else I have to do.
Yeah, that is a difficult one. And I think, to be honest with you, that comes with practice. I think you have to make yourself slow down, especially those of you with huge caseloads. It's very difficult. And some people, even without huge caseloads, you have to do your best while you're at work, and you have to really make yourself slow down, take those breaks, take that vacation. And when you're at home, do your very best to enjoy your life at home, your family, your friends. And over time, I think it gets easier. And I say that from being in the field 30 years and struggling with this for 30 years. It gets easier over time. And I can't tell you exactly when that switch flipped and I don't have these issues, but I know that for me, it got easier over time. And I did have to force myself to slow down and to take it easy, and to do some of these things that we've gone over.
And Pat Pfeiffer has her hand raised. Pat, can you talk? Pat? All right, sorry. Looks like Pat doesn't have a microphone. Maybe
I'm wondering if people have their computers on mute, if that's why.
Well, I unmuted it. Oh, you mean their actual computer?
Yeah.
It's possible. But I do think this, this webinar is really resonating with people, Laura and Laurie, because it is a tough job. And burnout is a real thing. And part of it is you just have to acknowledge that, recognize that, you're not alone.
Absolutely. Absolutely. And the other thing is you can always call anytime. And even if you just want to, and I do have people that will call and say, I just want to vent. And that's okay. You can call me anytime.
Except when she's at home.
Except when I'm at home. People know that, because when I'm home, I'm home.
There you go.
Yeah.
I had to joke with Suzanne about that one too. I told Suzanne that I was going to be sure Laurie covered that slide because she's much better at it than I am. I'm still working on that one.
Yes.
No, I've got my phone set up so that I have to go and actually click on my work email to get my work email on my personal phone. It does not just automatically pop up when I'm out to dinner with a friend that I have a work email. I have to go to it because I don't want it popping up when I'm out to lunch with a friend.
Pat, can you talk now? So Pat, we still can't hear you. I know your desktop is saying that you're muted by the organizer and it says you're unmuted. That's because I unmuted you, but we still can't hear you. So if you don't have a microphone on your computer, then we won't be able to hear you.
Well, I might take this opportunity, Suzanne. You had mentioned about the resources here. I'm just going to say about the Mayo Clinic one. That's a website that I really like to get good, credible medical advice. And if you're looking for, say, you see a diagnosis on somebody you're working with and you don't know what it is, they have it basically alphabetized in there under conditions, and it tells you the diagnosis, what it is, the most usual treatment, and the outcomes, and all kinds of things, and it says it in layman's terms. So it's an excellent resource. I just wanted to bring that out.
All right, so I'm going to say, Pat, why don't you just, oh, wait, there she goes. Sorry, I got a message to test my speakers. Says they're working. Am I unmuted? Pat, try talking now. Well, if you're talking, we're not hearing you. So why don't you just give Laurie or Laura a call afterwards, and I say thank you to both Laurie and Laura for doing this webinar. Like I said, this was a really valuable training for everyone, and have a good day, everyone.
Bye.
Bye-bye.